to kind of wrap my hand underneath the ankle here and just kind of stabilize here. Okay. This hand, I place it kind of right where the tibial tuberosity is. I like to think of the middle of my hand and the center of my hand right over the top of the tibial tuberosity. Something like this, okay? What you'll see with my shoulders is, again, my chest is going to be right over the top of the joint that I'm mobilizing. That one, are you okay? One shoulder, this one is moving down this way, and this one is lifting up this way.
Oh man, actually I've done this one and I got tired so quickly.
Yeah?
Yeah.
So, someone asked me yesterday why I wasn't holding it this way. I'm not sure why. You can. My biceps maybe doesn't like it too much.
Or less
This feels
strenuous.
more secure for me. That way her leg's not falling off. I have it blocked.
Well, the hand placement too, because you're going one, so it's like bouncing out the leg.
Yeah. But if you have shoulder impingement issues and you don't like to be in this internal rotation position, you might have to hold the leg this way. Okay, it's just whatever feels comfortable to you. So try both. You can hold it this
Okay,
way,
Elvis, calm down.
or you can try it this way. Okay. This hand. Sit down first. What knee issues do you have?
I don't even know, because I had chondromalacia patella. It would pop out of the socket and then come back in or something.
Wow.
It's just weakness of the hips and stuff.
Okay.
Yeah, it's just,
So this is
I guard it a lot with,
Yeah.
with
Ask your
everything
dad.
and subconsciously, so it's weaker.
that was the whole reflex inhibition that we talked about earlier. If you have some, let's say joint pain or swelling, it's going to inhibit some of the muscles around it. Okay, so that might be contributing to some of the weakness, maybe locally or distally up the chain or down the chain. You can also mobilize the knee above the patella too. So I can go into some extension here as well. Some people say this feels a bit more aggressive than the one here. Okay, but just depends.
And what does this help with?
This is good. I mean, for your knee OA patients who are lacking knee extension. Also, your total knee arthroplasty folks that come in, they want full knee extension before anything else.
That's what I mean.
This is a good technique. If you don't want to put your leg there, you can always just put a bolster underneath like this. She can put both legs up there or just one. Doesn't matter. And then you can come in through here with both hands. So I'm cupping it, just like you guys were doing with the hip. But it's like this now. And now I can work into extension that way. But I'm being very gentle with this. Because I can tell she's guarded, so I'm dosing it based on her response. So I'm not trying to aggravate the pain too much. So you can come here, or you can come up here and mobilize here as well.
And you're just promoting the fluid to move, right? To use
The synovium, some blood flow going. Okay. And that's kind of what you do with dry needling too. I mean, when you needle some of the points that you guys learned a few weeks ago, the whole point there is to promote some blood flow to the area, right? Dilate some of those blood vessels, the genicular arteries around the knee, and get some blood flow moving to the knee. Okay. More blood flow, more oxygenation, quicker healing. So the flexion one is, you can do it a few ways. Sometimes I like to put my hand underneath the tibiofemoral, it's right here. Get into some hip flexion. And I can use my body here, or I can just use my arm. I'm doing hip flexion mobilization here. So you can do it this way, or you can go ahead and bend this knee for me, and I can hook my hand here. Go ahead and bend it a little bit more for me here. Yep. I can come here and mobilize her knee into flexion this way too. Which one feels more comfortable to you?
This one.
Okay, so I'll probably just stick
Your
with this one.
movement with your right hand, is it down and in, or just
Applying force.
Just down, I guess.
down and in? Okay.
Down and yeah. Just trying to think of the proper word to describe it. I'm not trying to go like torsion it or anything. Like
Straight
this.
down and in.
Yeah.
Like you're like trying to get paper towels out of the thing.
Paper towels out of the thing. Paper towels. That's a good way to think about it. Sure. Okay. So those are a couple ways you can mobilize the knee into flexion. Okay. You can also mobilize the fibula too. You can kind of block the foot here, stabilize the ankle here. I guess I'll show you on this side. And I can do some anterior or posterior to anterior mobilization, or I can do anterior to posterior. No, I'm just kind of moving the fibula. I can either move it anterior to posterior this way, or I can pull it towards me this way. Okay.
Why would you?
Oh god.
Ankle sprains, if this is stiff.
Don't look up.
So I would
Don't look.
always ankle sprains, or if this just isn't moving. Let's say we've reached a plateau of the knee, and then I go and check the tibiofibular joints, and one feels different from the other, let's just say. And so I decide to do a little bit of mobilization to the tibiofibular joint. If you think about it, I mean, you have your tibiofemoral or femoral-tibial joint, right, or tibiofemoral joint, and then you have your fibular-tibial joint. It's still part of the knee, so don't forget about that joint either. Okay. Let's practice those and see.
Your legs are just there, right? You're not
Sorry.
stabilizing anything when you're messing with her left leg and pulling the fibula.
I should have been on the other side.
Okay.
Yeah.
So should you be stabilizing her foot? Is the question. Okay.
Yeah.
That's what I wanted to know.
Only because I just want to stabilize everything as much as possible. That way the patient feels comfortable. Like they're in good hands, right? If I'm here and I'm trying to mobilize from a distance, I'm not sure if they're feeling good or not. Like I want to be up and close and personal, of course.
When you're pulling the fibula, is your hand placement on top of the patella as you're pulling the fibula?
Because I'm stabilizing there too.
Okay, that's what I was thinking, but I forgot. I don't remember. I was too busy looking at your hand.